rise today to welcome the measures in the Queen's speech, particularly on skills, legislation to back up our white paper on adult learning, retraining to help people move across sectors, funding for that learning, and better career paths for people into work, particularly important in the wake of COVID, and vital to our levelling up agenda. If we're going to make a long-term impact, capital investment is all well and good, but actually this and education is the key to that long-term levelling up, and particularly also on immigration. There's a strong expectation amongst my constituents that we deliver in this particular area, and I welcome that commitment in the Queen's speech. There's a strong theme on levelling up throughout the Queen's speech and what it means, and the East Midlands is consistently at the bottom of the charts when it comes to government investment and private sector investment too, and therefore I'd argue most clearly in need of levelling up. I'd welcome conversations with any and all ministers about setting out a clear vision for that. It's my belief there are a handful of key decisions around HS2, devolution, our Freeport and Development Corporation that are fundamental to our long-term progress in the East Midlands, and when we can't afford to let our region down. And I know that the Minister from his Leicestershire constituency will appreciate the importance of our support for the East Midlands. But the theme today is health and social care. I've got a number of points to make in a very short time. First, I'm pleased to see the Government plans to make progress on social care reform in this session, and I welcome the elements of this in the speech. We know it's long overdue, and whilst ad hoc grants to support local authorities in delivery of this have been very welcome, they're not a long-term solution. We need certainty on this issue. I wonder if the Minister might, in summing up, give us some timescales, if he has those, for ideas and proposals coming forward. Second, on prevention in the Health and Care Bill, I welcome some clarity here and perhaps in truth to look again at some of these priorities. I've raised concerns about the obesity strategy before a number of times, and the proposals in my view that verge on meddling in people's freedom and choice. I think we've seen over the last 18 months that our public health functions have a huge amount to do to ensure their preparedness for major health issues, and we should focus on that rather than limiting people's choices in shops, pricing people out of items, or the dubious impacts, if any, of banning adverts. Let's support people with information, with facilities, to encourage healthy lifestyles and exercise. Banning 2-for-1 Mars bars is not going to get and make the impact that we would hope. The bill is set to look at a more integrated system of care between the NHS and local authorities. Can I make a plea to the Minister, I've spoken to him about this already, to start on the right foot by confirming our county's integrated care boundaries and fix those to the county boundary in Nottinghamshire. That can allow us to deliver more efficient and effective primary care. I know that's in line with government priorities. And unblocking the gateway in primary care is absolutely vital to offering a better experience to residents. It's an area we can make a big impact with an early and good government decision. The record levels of support and investment in our health service is something this government can be very proud of. We need to use this opportunity now to ensure that funding is put to good use with the most efficient and most effective service delivery for residents. Let's not waste it on meddlesome interventions in eating habits. Instead, let's look at direct support to improve healthy lifestyles for those who need it. Let's encourage activity, let's educate, let's improve access to community-based services, which is key to tackling our health inequalities, and therefore a big part of levelling up in terms of life chances. There's a huge amount to welcome in this Queen's speech, and not even touching the surface of it in just 4 minutes, but I very much welcome the proposals that have come forward. I look forward to supporting government over this session in its delivery.